Is there anyone in the world who has never experienced a headache? The World Health Organization points out that nearly everyone experiences a headache once in a while. But do you know the different types of headaches? Headache, or head pain, sometimes can be difficult to describe. The location may be in one part of the face or skull, or may be generalized, involving the whole head. There are many different types of headaches, and their causes and symptoms can vary. Today, we are going to tell you about the 10 different types of headaches. Number 1. Tension headaches. Tension headaches are dull pain, tightness, or pressure around your forehead or the back of your head and neck. Some people say it feels like a clamp squeezing their skull. They're also called stress headaches, and they're the most common type for adults. Although your head hurts, tension headaches usually don't keep you from your daily activities, and they don't affect your vision, balance, or strength. Number 2. Caffeine headaches. Caffeine affects blood flow to your brain. Having too much can give you a headache, as can quitting caffeine cold turkey. People who have frequent migraines are at risk of triggering a headache due to their caffeine use. When you're used to exposing your brain to a certain amount of caffeine, a stimulant, each day, you might get a headache if you don't get your caffeine fix. This may be because caffeine changes your brain chemistry, and withdrawal from it can trigger a headache. Not everyone who cuts back on caffeine will experience a withdrawal headache. Keeping your caffeine intake at a steady, reasonable level, or quitting it entirely, can prevent these headaches from happening. Number 3. Post-traumatic headaches. Post-traumatic headaches can develop after any type of head injury. These headaches feel like migraines or tension-type headaches, and usually last up to 6 to 12 months after your injury occurs. They can become chronic. Triptans, sumatriptan, beta blockers, and amitriptyline are often prescribed to control the pain from these headaches. Number 4. Hangover headaches. Consuming too much alcohol can lead to a throbbing headache the next morning, or even later that day. These migraine-like headaches are usually felt on both sides of the head and are made worse by movement. Someone who has a hangover headache may also experience nausea and sensitivity to light. There are no cures for hangovers, but it is possible to relieve symptoms by drinking plenty of water and eating sugary foods. OTC painkillers may help reduce or stop the headache pain. Number 5. Cluster headaches. Cluster headaches, which occur in cyclical patterns or cluster periods, are one of the most painful types of headache. A cluster headache commonly awakens you in the middle of the night with intense pain in or around one eye on one side of your head. Bouts of frequent attacks, known as cluster periods, can last from weeks to months, usually followed by remission periods when the headaches stop. During remission, no headache occurs for months and sometimes even years. Fortunately, cluster headache is rare and not life-threatening. Treatments can make cluster headache attacks shorter and less severe. In addition, medications can reduce the number of cluster headaches you have. Number 6. Allergy or sinus headaches. Headaches sometimes happen as a result of an allergic reaction. The pain from these headaches is often focused in your sinus area and in the front of your head. Migraine headaches are commonly misdiagnosed as sinus headaches. In fact, up to 90% of sinus headaches are actually migraines. People who have chronic seasonal allergies or sinusitis are susceptible to these kinds of headaches. Sinus headaches are treated by thinning out the mucus that builds up and causes sinus pressure. A sinus headache can also be a symptom of a sinus infection. In these cases, your doctor may prescribe antibiotics to clear the infection and relieve your headache and other symptoms. Number 7. Rebound headache. Rebound headaches, also known as medication overuser headaches, are caused by the frequent or excessive use of pain-relieving and/or anti-migraine drugs to treat headache attacks that are already in progress. Note that these are not the same as oral prophylactic or preventative medicines which should be taken daily. In other words, the same medications that initially relieve headache pain can themselves trigger subsequent headaches if they are used too often. Medication overuse headaches can be disabling, forcing people with this condition to take sick leave and to be less productive at work and at home. This headache is more common in women and in people with chronic pain conditions and who have depression and anxiety. Number 8. Exertion headaches. Exertion headaches happen quickly after periods of intense physical activity. Weightlifting, running, and even sexual intercourse are all common triggers for an exertion headache. It's thought that these activities cause increased blood flow to your skull, which can lead to a throbbing headache on both sides of your head. An exertion headache shouldn't last too long. This type of headache usually resolves within a few minutes or several hours. Analgesics such as aspirin and ibuprofen, Advil, should ease your symptoms. If you develop exertion headaches, make sure to see your doctor. In some cases, they may be a sign of serious underlying medication condition. Number 9. Migraine. A migraine can cause severe throbbing pain or a pulsing sensation, usually on one side of the head. It's often accompanied by nausea, vomiting, and extreme sensitivity to light and sound. Migraine attacks can last for hours to days, and the pain can be so severe that it interferes with your daily activities. For some people, a warning symptom known as an aura occurs before or with a headache. An aura can include visual disturbances such as flashes of light or blind spots, or other disturbances such as tingling on one side of the face or in an arm or leg and difficulty speaking. Medications can help prevent some migraines and make them less painful. The right medicines, combined with self-help remedies and lifestyle changes, might help. Number 10. Hormone headaches. Women commonly experience headaches that are linked to hormonal fluctuations. Menstruation, birth control pills, and pregnancy all affect your estrogen levels, which can cause a headache. Those headaches associated specifically with the menstrual cycle are also known as menstrual migraine. These can occur right before, during, or right after menses, as well as during ovulation. OTC pain relievers like naproxen, Aleve, or prescription medications like Fovotripan, Frova, can work to control this pain. It's estimated that about 60% of women with migraines also experience menstrual migraine. So, alternative remedies may have a role in decreasing overall headaches per month. Relaxation techniques, yoga, acupuncture, and eating a modified diet may help prevent migraine headaches. Well, there you have it, 10 different types of headaches. If you've made it this far, don't forget to like the video and subscribe to the channel for more amazing videos in the future. Also, don't miss those amazing videos popping up on your screen right now. You won't regret clicking away.